Well, medical lab professionals in Ontario are facing an unprecedented volume of tests as they work to determine new cases of COVID-19, but limited staffing and supplies have led to a backlog of tests waiting to be processed. Several hospitals have since offered their labs to help clear the backlog. For more on this, Michelle Hoad joins me now. She's the CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, appreciate your time here on CTV News Channel. So give us an update now in terms of, we know, increased testing in Ontario, but of course, getting those test results back is critical. What's the situation right now?
Well, we're happy to report that we processed 9,400 tests yesterday. So currently, they call them backlog, but they're actually referred to as under investigation, 6,800. That's actually really good news because over the past 6 weeks, we've actually had many other labs come online that have been able to alleviate the pressure off of the public health labs.
And having these tests done, getting them into the labs and getting the results coming in with, of course, we're hearing from health officials how critical the 2-week increments are as we try to see how we're moving through this pandemic. So talk to us about how important it is to have these tests done as we're looking at those 2-week periods to see how far we've come.
Well, it is important to ensure that people in Ontario get their results in a timely manner. I am happy to advise that there are 6,300 medical lab technologists in the province working throughout a variety of labs. They're working 24/7 right now to ensure that those tests happen. The average turnaround time is anywhere from 24 hours to up to 2 days. That is much better than the situation we were in several weeks ago.
In terms of who is getting tested, are there any restrictions on that in terms of who might be high priority versus someone who may not need to be tested?
I believe those definitions were actually defined by the ministry. Just last week, they were updated. So there's a specific listing, but definitely our healthcare workers are priority. Long-term care home, retirement homes are definitely a priority right now.
As you've given us sort of now the update on where we are in alleviating that backlog, those investigations, are there any other concerns? Because we're far from the end of all of this. And also I know that having to have other labs now come on board to help with all that testing, as well as getting the proper equipment and supplies, are there any other concerns here as we move forward in this pandemic?
I think the one ongoing concern is definitely around materials for labs. So reagents is something that is actually used during a COVID-19 test. That is currently being procured in Ontario, across the country, and across the world. So we are waiting in line with many other people in regards to finding reagents. So we'll have some hospitals that can run to capacity for a bit of time, and then they'll have to wait until those reagents get shipped. In addition to that, I think we as people in Ontario need to be patient because a lot of the processing of the test, the data entry, a lot of that is actual manual. So when we have assessment centers that pop up, there are people who are actually receiving the test and actually have to type in that information. So just keeping that in mind when we are waiting for results will almost allow us to appreciate the work that's being done.
Well, certainly if all of those lab technicians, as you mentioned, researchers, et cetera, that are doing such essential and critical work in all of this. Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario, really appreciate you giving us your time and really breaking it down for us, Michelle. Thank you. We wish you and your family safety.
Thank you. Thanks for having me.
You're welcome.